Hi, my name is Austin Johnson.
Hello, my name is Graham Hall.
For our senior thesis project, we wanted to do something, that meant something to us. So we began to look into the epinephrine auto-injector and how we could improve it.
For this thesis, we decided to make something that would help consumers and something that was very medical based, and so we wanted to do something that would help people who are less fortunate and also can't afford this product to get the life-saving drug that they need.
We wanted to look into the design of the epinephrine auto-injector and find how we could make it more cost-effective for the consumer, but still retain the same efficiency. The EpiPen was originally designed in the 1970s by a guy named Sheldon Kaplan. Its original intention was actually to inject antidote for deadly nerve gases used during the Vietnam War.
In 2004, Mylan acquired the EpiPen from Sheldon Kaplan as a product to be used in the civilian field, which we now see as the epinephrine EpiPen auto-injector. The EpiPen in 2008, however, ended up being price gouged, to which it sat at $60 to where it sat at roughly $350 by the time of the 2016 Mylan hearings. Now, this was discussed in many fronts to be able to fix this problem, in which they looked at a congressional hearing first to see if we could talk Mylan down from their prices. However, after this did not turn out as well as they hoped, Mylan ended up price gouging their EpiPen even more, from the $350 to what it sat then to at $700 now for a pack of 2. This has been seen as a problem, and although multiple trials have been attempted to be able to fix this on a congressional front, we have seen this to become highly ineffective for what we are doing. In 2016, Mylan also unveiled the EpiPen Jr. as their fight against the Mylan EpiPen hearings to lower the prices, as they used that device to say that their prices were effective based off of the fact that they were offering this one for cheaper. Although that did not do very much, we then saw the EpiPen price go from a $350 for a 2-pack to $700 in 2020.
Another attempt to solve the EpiPen problem was with the device known as the AviQ. This device used air compression to inject the epinephrine into the system. The AviQ had several of the same problems as the EpiPen, the main one being that the price also inflated from a more affordable option to over $5,000. The AviQ actually had several mechanical issues, causing it to have to be recalled.
Another device that was attempted to help balance out the monopoly that is Mylan with the EpiPen was the AdrenaClick. The AdrenaClick was unveiled as well in the early 2010s, around 2011, in which this device was a very similar device to the EpiPen, but it also went along the EpiPen patent. This became problematic as the EpiPen contract only allows for sales of their device that is very similar to the patent or potential patent infringing to be sold for only 1 year to a consumer. So the AdrenaClick, although a much less expensive alternative, sitting around $120 for a pack of 2, does cause problems for the EpiPen crisis, as they can only get that device once before having to switch over to the Mylan EpiPen. After much deliberation with my partner Austin, we ended up deciding to base our thesis off of doing a redesign of the auto-injector. This was due to the fact that after we saw that the congressional hearings did not work, we also had some really good ideas that could revolve around fixing the EpiPen crisis. This was believed that we could either do a complete redesign, in which that's kind of the path that we chose, or we could make a much cheaper manufacturing process for the current design to be released in 2025 when the EpiPen patent expires.
We had 3 designs that we had decided upon, and it was down to picking between these 3 designs. The first major design we looked at was a hydraulic design, where hydraulic pistons would inject the epinephrine into the user's system. This ended up being far too bulky and not a very fast-moving system. It was too slow, along with other issues.
The second design that we looked at, though, was the electric system. This one we believed would have worked really well, it would have been very efficient, and it would have been fairly inexpensive to make. However, when we looked into it, we realized that there was going to be more components that we would need to make this design work, and it was going to become very bulky and very expensive very quickly. It was also very complex for what we were trying to do, and we did not have enough time to look into this more in depth, as we were afraid that we would not be able to have a product by the time that we would get the design figured out.
The third design was a mechanical-based gear system to inject the epinephrine into the user's system. Based off of our previous two designs, we learned that simplicity was key in the design, and that's where we developed this.
This is the design that we went with, and it has shown to be very effective, and through our design that you will see momentarily, this design has worked efficiently and the testing has gone well, and we have seen plenty of pros with this, as well as very inexpensive to make, and it's very simple.
So after we decided not to go with the electrical model, we decided to simplify it down quite a bit. So we're going with a gear-based model, very simple. When the button is pressed, this piece will go up, pushing this piece down, and the syringe down, injecting. So it's all kind of one motion, and it should be much simpler, way easier to do, and more efficient for the consumer, because we can make this very cheap.
This is the working prototype for the RotoJect design. How this thing works is this is using gear ratios, in which there is a linear gear on this side and a linear gear up here, and there is a swivel gear in the middle that is able to use the pressure from the up and turn it into the down pressure. So how this is there is a needle that is locked into place, and this button moves 16 millimeters, which is the perfect depth for the design. The epinephrine typically injects between 16 and 20 millimeters, so this exposure of the needle is right about perfect for where the epinephrine needs to go into the leg. How this design works is when this linear gear gets pushed up, the rotator gear in the center will spin, causing the plunger gear to move downwards and inject the epinephrine in the system as the button gets exposed. This will work very efficiently, as there is also the ability to have a locking mechanism in the side here, which would prevent the needle from being able to move down and exposing the needle, keeping it as a safe product within a person's pocket or in a woman's purse if she decides to put it in such. This design is very efficient. We have not seen any major problems with it, as well as it's worked almost every single time that we've tried. You may be wondering, why is the RotoJect a much better design than the EpiPen? The wonderful thing about this is the EpiPen costs about $12.50 to manufacture, where this only costs around $6 for us to make. The majority of parts in this are 3D printed, which means it's highly versatile for anybody to manufacture. And it's also very cost effective for each consumer, as the complexity has been slimmed down to very little, as there's only 3 moving parts in this entire design. Unlike the AviQ, this one is not extremely complex, which allows it for it to be easy design. It's very easy to handle. The wonderful thing about our RotoJect design is it is about the size of a phone, so it only feels about the comfort of what somebody would feel like in their pocket with a phone. So, as many of you know, your phone probably do not feel nearly as much in your pocket. This is the purpose of this design, is to be right about the thickness of a phone and right about the length of the phone. So it's very comfortable to have in your pocket, especially you guys. And for the women, it's very easy to carry in your purse, where it's not too small where you can't find it, not too big that it takes up the whole room. With the RotoJect design, we are not able to do product testing with people, as it is not FDA approved, and it is a medical product, which means that we can only really test for functionality. Although the EpiPen only has 96% efficiency, we believe the efficiency of this design would be a little bit higher due to the fact that it is a whole lot more simplistic to use if we were to test on human subjects. Now, the fact that we were able to do ballistic gel testing, we were able to see that it has 100% efficiency in its functionality. With that, we were able to use a different color dye in the system to make sure that the design was injecting properly into the ballistic gel. With the RotoJect, it is still a proof of concept, but it is a much more productive prototype than our previous designs. The reason behind this is ready to be considered for marketing, in the sense that the design works, and so there would be plenty of things that we would change with the product, at least with the aesthetic and chic design of it, just to make sure that it is in a standard for marketability. Some of the considerations that we would have in the future would be a much more slim design, as well as making sure that the corners are rounded out, making sure this is still very comfortable to hold and grip, and making sure that the user has a firm grip when using the device in their hands. In the future, we'd like to see implications with this being used in the medical field with insulin, as well as narcotics, in which the insulin would be used for diabetics and narcotics would be used for people on drug overdoses. So this could be used in the medical field with ER nurses, as well as ENTs and firefighters to help with drug overdoses as well. With this design, we were mainly focusing as well on the fact that it is single motion, which has been shown to be beneficial with the EpiPen to make sure that people aren't scared to use the device, and so the implications of that would become much higher in the variety of the field. This design would be a whole lot more effective in the field as it is only single motion and you do not see the needle when you're injecting the system. That's why the EpiPen is so effective with that, is because patients are not afraid to use it. With this design, we had a lot of fun with this year. It has been a blast to be able to work with this and be able to manipulate this thesis into our choosings. If we could change anything, it would be hopefully to have a little bit more time to be able to market the product and have a little bit more fun with it. Due to our time constraints and the fact that we are dealing with a medical product, we took it as far as possible, but we would love to see this potentially grow into something even bigger.
Thank you for watching our thesis presentation video. A special thank you to Kurt Hallquist for mentoring us through this project. Thanks to Mr. Guthrie for advising us. And thanks to Ms. Rowland and Benjamin for helping with the writing part of the thesis.